those who don't remember, my name is Kelsey Marquardt. I'm the International Admissions and Retention Coordinator, which means I help with the admissions process and also make admissions decisions for undergraduate students. For graduate students, we loop in also the director of the MBA program, Dr. Brian Curry. So congratulations. These are all accepted students who have made it over those big hurdles. So congratulations. And then turning it over to Jim.
Let's wait 1 second. I have a gentleman using a leaf blower outside my window, so I want to make sure everyone can hear me. If you can, I'll start.
I can hear you. I can hear you just fine.
We'll start. So I'm going to start off by saying good morning, good afternoon, and good evening. It sounds like everyone is in the morning. We have Saudi Arabia and India. So first of all, thank you so much for depriving yourself of some sleep to attend this session. I greatly appreciate it, and I also I applaud your dedication. It's very difficult to dedicate time to this, and I know myself. I'll go through my credentials in a moment, but when I did my MBA, I had students, I had classmates from India, Nigeria, China, Mexico. So trying to get all the time zones together was very interesting and actually very rewarding. But this is a big commitment of time, and I applaud you for your efforts in doing this. So what we're going to do this afternoon is I'm going to go through what a typical MBA class would be. I'll use some examples of the class that I teach, a couple of the classes that I teach and how I do it. And then we'll just open it up for general questions of anything that you have. So I'll give you my introduction. So my name is Jim Tarasovitch, and currently I am a Regional Chief Financial Officer for Ascension Health System. Ascension, and I'm located in Wisconsin. So being a Catholic health system, we always call each of our geographical areas a ministry. So that's why you'll see Ascension Wisconsin Ministry. We're faith-based, and we are the largest Catholic healthcare system in the world, and we're one of the largest healthcare systems in the United States. I'm one of, I think, 160,000 employees with Ascension as of yesterday. So it could change, we're adding, and people are going through. So prior to that, I was a regional CFO at Mayo Clinic Health System. And if all of you are familiar with healthcare, Mayo Clinic is internationally known as one of the best healthcare systems in the world. And I was fortunate enough to be the CFO for the state of Minnesota on our community-based hospitals. And for those who don't know the difference, Mayo Clinic has three business lines. They have what I'll call quaternary care, and that is the education, the research, all of the transplants and things of that nature. So that's the highest level of care. We have three sites: Rochester, Minnesota, Jacksonville, Florida, and Scottsdale, Arizona. And then we have a community-based hospital, and that is what I would call your normal hospital, where you're doing your hearts and you're doing your knees and you're doing your primary care and things of that nature. So I was the CFO for 11 hospitals in the state of Minnesota as well. I was fortunate enough to, when I was getting my MBA, we did one of our residencies in China, and I was able to visit a joint venture that Mayo was putting together in China. So I got to blend both work and education at the same time. So it was very nice. Prior to that, I was a CFO for a regional hospital in Bradford, Pennsylvania. That is where I would call home, is Pennsylvania. I've traveled, my career has taken me across the United States. And also I've held some CEO jobs and other senior leadership jobs. I am a certified public accountant. I'm still licensed. And what that means in the United States, I have to maintain 80 hours of continuing education every 2 years. And so I keep that up. I did receive my MBA from Walden University, and my undergraduate degree is from Mercyhurst University. So that's a little bit about myself. So a typical MBA class is 8 weeks in length. We meet for about 4 hours each week with outside classroom assignments and topics. You should really expect to spend between 10 and 15 hours, but that's really dependent upon you, your class load, and your ability. Sometimes a class will click with you and it might be 10 hours. Sometimes the class may be a little more challenging and it may be 20. So I'm giving you a kind of a ballpark of what you can expect, okay? Next slide, please. So the typical in-person class is as follows. Lecture and review of the week's readings. In the MBA program, we are expecting our students to come into the class prepared. So we want the readings and the assignments done prior to you coming into class. Because unlike an undergraduate program where I'm doing a lot more lecturing, a lot more teaching, in the graduate level, we expect you to have that base knowledge. So now what we can do is we can have discussions around questions you have, clarifying the readings and concepts, and then spending time doing case studies and presentations and applying them to real life situations. So one of the benefits that I bring is that I'm still very active in the healthcare world. So I'm bringing real life situations to the classroom and exposing you to that and saying, okay, now, given what you've read, how would you approach this situation? What would be your recommendations? So we do a lot of dialogue, and I spend a lot of time doing group and individual analysis in the class. So again, we want you to have that base knowledge walking into the class, then we can have a discussion. So it's much more interactive versus sitting down in the undergrad. I remember when I taught some undergrad classes, someone asked me, how do I know that it's on the test? And my answer was, if I said it, it can be on the test. And that scared everybody when we start writing everything down. And that's not the way it is in the MBA. So again, we can answer your questions. I see some questions are coming up in the chat line. We can go to the next class. So I said this a little bit earlier, student participation is mandatory. You're not going to get the full benefit out of the class by sitting there and just taking notes. You need to participate, and it is weighted heavily on your overall grade. It's encouraged that you discuss various viewpoints, and I believe now I'm going to give you an example of something, and you're all way too young to remember this, but I'm going to use a concept called point counterpoint. And I love when a student brings up an answer, I will take the opposite position, not because I agree or I disagree, it's because I want to have respectful discussion for two reasons. I want to make sure that you are committed to your answer, that you have thought it through, you've looked at the facts, and you understand all the aspects, or you think you understand all the aspects of the question. And I expect your fellow students to do the same thing, but we have to do this in a professional way. Right now, all governments in the world, we tend to yell at each other, and that's not what we want to do. We want to have respectful conversation, because through that conversation and that dialogue is our greatest learnings. So that's very important of what we do in our class. You need to be open-minded. We come from multiple cultures, which I find fascinating. As I said earlier, in my MBA, I had classmates from China, from Nigeria, from Mexico, and from Australia. And getting the different viewpoints from the different cultures is a gift that is phenomenal, because if we're very parochial and just have students in the United States, well, we just understand what the United States is. So coming from multiple cultures and multiple countries, we have the ability to learn from each other, and that to me is the best part of learning, and especially in the international business. Okay, and then understand really the importance of how policies are made, why they're made, and what is the criteria that they're made on. Because we know policy is also politics, and in the reality, politics can skew or can heavily influence how a policy is determined. In the United States, I'll use an example since I teach healthcare. In the United States, we passed what was called, we affectionately call what is Obamacare. President Obama passed the Healthcare Act, but it was very heavily favored by one political party. And we have been fighting over that policy for the last at least 3 years. So again, you need to understand politics, you need to understand the legalities, and you have to understand the rationale of why these policies are made. Okay. Go to the next slide. Okay. So I'm going to give you 2 examples of what we would do in class. Okay? And if you would take this online, the example would be the same. And what I would require you is not to respond to me, but I would require you to respond to 2 or 3 other of your classmates. Again, to create that dialogue. So here is something that it's very typical. As a leader in your hospital, you've been presented with 2 capital projects that will require the same amount of capital resources. So as an example, I have 2 projects, they both cost $2 million. The first project is an expansion of an imaging department with a new MRI, and the second is a construction of 3 additional emergency rooms, ERs, emergency rooms, okay, to meet potential demand. That means we've done our analytical work and we see our volume growing, and we think we're going to need more rooms to meet the needs of our community. So I'm going to ask you, what is the opportunity cost or the opportunity revenue of selecting either project over the other? Assume there's no significant change in reimbursement. And then in your discussion, tell me what the ramifications are if we don't select your project. That is what I'm going to have the students, I would have you, I break it out, depending on the size of the class, I might break it out into groups. If it's a smaller class, with our time, I may do it individually. But this is where I want you to think. So as I teach this, I always tell my students, I want you to look at 3 different lenses. I want you to look at the legal lens, I want you to look at the finance lens, and I want you to look at the ethical and moral lens. If we miss any of those lenses, we're not fully evaluating the issue at hand, and we're going to let one of the other 2 lenses trump a decision. And sometimes that may happen. Sometimes it may be, we only have so much money. And even though this project makes more sense, we only have money for half of that project. So we select something else. But again, I want you to look at that full scope, okay? Secondly, the next project, the next question is, similar thing. What would be the economic impact on the U.S. economy? Now, I can easily change that to the Indian economy, the Saudi Arabia economy. It really doesn't make a lot of difference. But in this situation, we're studying U.S. healthcare, and we're going through the discussion of whether we should adopt a universal healthcare policy, or do we retain our blended policy that we have right now and move to some type of value base. But I want you to understand, and I want you to include the influences of the aging population, the tax consequences for the individuals and the employers for either decision, and what's the impact of the overall buying power of individuals for all other economic purchases. Because we have to understand there's not an endless supply of money. You're all educated people, you're all working, you still have to have living expenses, home, food, transportation, and most importantly, education, right? That's why you're here. So, but how does those decisions impact? Because we may ethically believe that we should have healthcare across the board for everyone. Okay, that's fine. It's a great decision. What are the economics? What would the tax rate go up? What would I gain? What would I forego? How would that impact my decision on home, car, my other choices of living? The social economic impacts are huge. And also the other thing that we would look at are what are the other social determinants? Because we also understand that not everyone in any society is created equal. So we have a portion of our society that is on the lower social economic status, and their needs and requirements are substantially different than those of someone who are middle class or upper middle class, or have more economic ability to influence their buying power. So these are the type of questions that we have. This is the type of dialogue. And the readings in the class that you would have will prepare you for these questions. Again, probably spend an hour talking about what the readings were, what the homework assignments were, any questions on the readings. I would then probably highlight what I felt is important, okay? And then we would go into this dialogue. Now, every professor is different. In an MBA class, I am not a professor who gives examinations. I'm a professor who believes in the dialogue. As I said, I'm spending a lot of time on this. This is where I believe the learnings are. And at the end of this course, I'm going to require you to write a paper on a healthcare topic and going on the criteria. So midway through the course, usually week 2, you would give me your topic. Week 4, I would require a detailed outline. And then week 8, your paper is due. Now in class, if your paper is due, I'd probably have you give the presentation to the class. Again, and so the way I like to do this is, since I'm in the business world, if you're giving a presentation, these are the rules. You're presenting to me, not as a professor, but as the chairman of the board or the president of the company. Your classmates are not classmates, they are board members or fellow senior vice presidents, and they have to make a decision. So I want you to start getting used to speaking to people in authority to make the case for your topic. Why do you believe this is important? Why do you believe we should do this? Okay, now again, this is the way I believe we learn. This is the way I think it is. I could give you a test, but I just don't think at the master's level that's the way you learn. Now, that's Jim Tarasovitch speaking. Kelsey could be another professor, and she could give you tests. There is no right way, there is no wrong way. It's just the philosophy of the professor. But most of the classes that I've taught in my MBA were taught this way. And I think because my MBA was all papers and projects, I like that way of learning. So it's influenced the way I teach. But I've been teaching for 30 years in undergrad and at quite a few universities, and I've done the teaching as well. So it is about 20 minutes I've spoken, and that's probably more than enough you want to hear me. So I'll open it up to questions, and we can go from there. Kelsey, you're on mute. I don't know how you want to do this.
Yeah, this is great. So if you guys have questions, you can feel free to write them in the chat if you'd like for Jim, or if you want to unmute yourself, you certainly can do that too. So to unmute yourself, if you're on a computer, if you press spacebar, that will unmute yourself. Or there should be a microphone in the bottom left-hand corner where you can unmute yourself. But otherwise, you can put questions in the chat as well. So this would be time to ask about like, what other courses are there, or how has your MBA helped make connections so that you can then go on to a profession, or what profession are you interested in? You know, these are great questions to be asking right now, especially for someone in the healthcare side of business. So how did he get into his, that's a question I'll ask, is how did you find yourself from into the position you are?
You know, everybody has a story, and so I'm going to give you it was my college motto, and I've kind of adopted it. It's called Carpe Diem, and Carpe Diem is seize the moment. And so I'm always a believer. I started off actually as a pre-law student, and realized that as much as I loved the law and other things of that nature, it probably wasn't the right profession for me. And I started English, and my advisor said, "Why don't you take an accounting class?" And I was like, "Geez, you know, accountants are kind of boring and everything else." But long story short, I took an accounting class, and I did very well in it, and I evolved, and I ended up taking a double major in accounting and business administration. And I got into public accounting. I worked full time in public accounting when I was in college. I'm a little type A. I graduated in a little over 3 years with a double major, and but I got into public accounting, and from there, I'll have to pause in a second. I have to extend my session on my computer because I've been working all day from home. But anyway, I was in public accounting for 10 years, and my wife and I just had our second child, and he had some health problems when he was first born, and I had an opportunity to get in healthcare, and I thought, you know, there's got to be more than just doing taxes. I want to help people. So I guess my personal mission of helping people is what drove me to healthcare, and I've been in healthcare for 30 plus years. So.
Amazing, thank you. And I saw Mohammed, hello, nice to see you.
Yeah, hi.
Did you have a question?
Yeah, I do. If I want to pursue the master's degree in MBA, what should my bachelor's degree in?
That's a great question. Haven't you already been accepted into the MBA program?
No, actually, I'm physiotherapist.
Oh, okay. So what program did you, MSRS?
Yeah.
Oh, okay. So for the MBA, really, a lot of people come from a variety of different backgrounds and go into an MBA. So it's more of like, what do you want to learn? So if you already have a physical therapy, are you looking to like start your own business and how to manage that? Because then that would determine what concentration you might be looking at.
But can I be accepted to the MBA with a bachelor's degree in physiotherapy?
Oh yeah.
Yeah, heck yeah. So you've already been accepted for the Masters of Rehabilitation Science as well. So that could be a conversation we have later if you want to also apply for the MBA and see if you want to do that.
I'm just thinking about it.
Sure.
Yeah. Most people who join into the MBA are usually getting into the field that wasn't their primary field. So most of the students that I teach are RNs, registered nurses, or nurses trying to become advanced practice practitioners or pharmacists, and they're seeking their MBA. So I have a lot of friends who are nurses and now went and got their MBA. So yeah, your undergraduate degree does not preclude you from getting the MBA. I think.
I see.
Okay?
Yeah, thank you.
You're very much welcome.
Yeah, business is kind of the universal language on which other professions happen. So no matter if you're like a physical therapist, right, you need to understand we have a budget, right? So being able to keep those key things and strengthen them in order to become in a more managerial position where you're overseeing things like that in your field is really what people are looking for too. So we have a lot of concentrations in the MBA program to acknowledge that and to help people who are looking for an MBA get the MBA they want. So there's I think it's 15 now concentrations for the MBA program. Yeah, so I will put a link to the MBA program in the chat so you guys can check out those concentrations as well.
Yeah, and most of my students are crossovers. Like I said, they're getting their master's in nursing, they're getting their doctorate in advanced, their doctorate in nursing, their pharmacy majors. So they're crossing over into the MBA and the healthcare side as well.
All right.
Okay. Other questions? I know it's early in the morning.
Okay, I just put the link to our MBA program in the chat, so you guys can check that out if you'd like to see the MBA concentrations. We do have 2 of them that are STEM approved, so if people are interested in getting the STEM OPT extension, that we do have concentrations that qualify for that as well. And while I'm still chatting and putting things into the chat box, you all may know, if you've been on previous Concordia 101 sessions, that we are having a Concordia 101 raffle. And the raffle is for a prize at the end. And in order to register for that raffle, you go to events, and each of the events has a separate survey link where you tell us what you liked, what you didn't like, what we could do better. You get to rate Jim and myself of, are we good presenters or not? Feel free to be honest. That's what the survey's for. It's also for us to just see who came. So it's a great way for us to just see what was more popular. Because as we are in this pandemic, we're being creative, right? And some of those creative solutions are going to be with us post-pandemic. And I think one of them is going to be this Concordia 101 week. So we're looking at how we can make it better for next year for potential students. So does anybody have other questions for Jim? Oh, yes, go ahead, Mohammed. Mohammed, you raised your hand in the Zoom, so if you would like to unmute yourself, go ahead. Oh, mistake. That's okay. Lots of buttons happening. That's all right. It's also probably very early where you are, so I again appreciate it. Okay, so I did have Ashlyn ask me a question in our personal chat to say that she had questions. So if you have at this time international admissions questions or questions of that nature, I would be happy to talk. Just as a general overview, if you guys haven't been in other sessions before, and I see some new names. So just as an overview for everybody, we are still issuing I-20s. We are still issuing those documents because we want you to have everything you need when those visa interview time slots open up, that you have everything you need to say, yes, I'm ready to go to those. So we're still issuing I-20s. If, however, you are not able to secure an interview time slot in time for your preferred start time, we will be happy to defer your I-20 free of charge, because we know that this is a crazy time and we want to be as flexible as we possibly can. So we will defer those I-20s free of charge. That is going to be a personal decision and also a very individual decision. So if you want to communicate with us and let us know what your plans are, I'm putting our general email here in the chat as well. So feel free to email us letting us know what your plans are. There is that. If you would like to begin your studies online and finish on campus so that your timeline is still maintained, we understand that too. Again, we're going to be as flexible as possible. So if you want to start online, great. We will still defer your I-20. And again, that's going to be an individual decision. Feel free to email us, okay? And all of the MBA courses and Jim in particular, he specializes almost in online classes. So you'd have a very experienced professor as well if you were to take classes from Jim. Okay, so I think that was my spiel. I know I'm going to stay on the line for Ashlyn, but if anybody else wants to stay on for international admissions, great. But otherwise, we will say goodbye to hardworking Mr. Jim. Tarasovitch, because he is also working many hours as well. So thank you very much, Jim, for your participation.
And I wish you all the best of luck. This is a great opportunity for you. And again, I can't tell you how much I understand the hard work it's going to take, and I understand the appreciation when you graduate. And for me, trust me, Kelsey mentioned it. Even though I got my graduate degree a little later in life, it has paid significant benefits. So it's a great investment for your time. So if I can ever help, please reach out to Kelsey or myself, and I'd be more happy to answer some questions at any time. So you have a great evening and try to get some sleep.
Yeah. All right. Bye, Jim. Thanks.